I'm Rebecca Ruggles. I'm with the Maryland Environmental Health Network. I live in Baltimore City and I read the Baltimore Sun, and every week I see what Dominion buys with their money. A full-page ad. This one says 7 facts about Cove Point. I'd like to take issue with their facts, but my job is to talk about health, so I'm going to give you 7 questions. 7 health questions about Cove Point. The first one is noise pollution. We know that noise pollution is linked to sleep disturbance, aggressive behavior, even heart disease. What will the average decibel level be at Cove Point? And also, what will it be at the compressor stations that have to be built every 40 to 70 miles along the pipelines that will bring that gas to Cove Point? My second question, pipeline explosions. Who's keeping count? A week ago in Kentucky, 3 homes were destroyed. And in January, there was a massive explosion in Manitoba, Canada, and 4,000 people lost their natural gas to heat their homes. It was sub-zero temperatures that week in Manitoba, Canada. What were the health impacts on those people? My third question, radon effects. How much radiation is emitted from pipelines with shale gas? We don't know. Radon testing is required in homes because we do know that exposure to radon over long term causes lung cancer. What's the radon exposure related to shale gas? My fourth question is air pollution. Exporting shale gas will mean more drilling, more wells, more truck traffic, more air pollution. How many more asthma cases, I'd like to know? How many more asthma-related emergency room visits? We're actually starting to have this data for places like Wyoming and Colorado where they never had smog before they started doing shale gas drilling. Fifth question, water contamination. We've heard a lot about the unanswered questions related to the contamination of drinking water in communities where the drilling takes place. I'd like to know what the effect will be on the bay. Will Cove Point warm the bay? When you warm the bay, we start seeing more and more harmful algae blooms. So just in terms of human health, that's cyanobacteria, that's saltwater bacteria like Vibrio. These are really noxious things, bad for people. My sixth question is climate. Climate is a huge health threat. Climate change means disruption of critical care during major storms, more allergic reactions to pollen, more West Nile virus, more heat stroke, and ultimately threats to our water and our food supplies. So what's the life cycle greenhouse gas impact of Cove Point? That may not sound like a health question. It is. It's a health question. And my last health question, economic inequity. Cove Point is about profits for the oil and gas industry. Look at the regions that have a history of extractive industry. They're poor. After decades, they're still poor. Southwestern, northwestern Pennsylvania, West Virginia, rural Ohio, rural Texas. Poverty has been called the single greatest risk factor for poor health. We need health-promoting energy, not mega projects that make gas industry wealthy while the gas field workers go without health insurance. Is there such a thing as healthy energy? Yes, solar power. What are solar's health effects? No noise, no smog, no water contamination, no radon, no heat island, no greenhouse gas emissions. That's healthy energy. Cove Point proposal poses huge unanswered questions. This says Dominion claims, quote, they are committed to answering each and every one of our questions. So conduct a full environmental impact statement and let's get the health questions at the same time. Thank you very much.